This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh, where we're going to be talking with Dr. Kristen Sandoe. She's an orthopedic surgeon who's fellowship trained in both foot and ankle surgery. And today we find out why you've got that toe pain and what we can do about it. Well, thank you for taking some time with us once again. Today we're talking about toe pain. I know a lot of people suffer from toe pain. I know that I have toe pain. I'm just not sure what's causing it.
There are a lot of causes. Three main causes of great toe pain, specifically the great toe joint here, is gout, bunions, and arthritis of the toe joint. So those are your three main causes.
Yeah, and can we break each one of those down? Let's talk about gout. First of all, what is gout for people who don't know, and how does that affect?
Absolutely. So gout is typically, it attacks the great toe joint pretty commonly, and it's basically an inflammatory situation of that joint, typically from dietary changes in uric acid level buildup. In that joint, you get a real red hot, swollen, painful joint, very painful to touch, very painful with motion. And typically that is dietary modifications to cut back on your calcium intake, and then also medical management. So really that's not a surgical situation unless you get destruction of the joint or the arthritis of the joint as a result of the inflammation and the chronic inflammation. But basically that's a medical treatment, and you take some medications, and usually that's pretty controlled.
Okay, so from gout to bunions, that's a little different.
Absolutely. So a bunion is basically where you get the bone, the first metatarsal turns out, and you get a little bump on the outside of your foot there. That can be very painful. There's a little nerve that lives right over that bump that rubs and gets a little irritated, so you can get some numbness, tingling, some swelling in that joint. Shoe wear discomfort is the big one. So if you wear really narrowed shoes, you'll feel that, and it'll be pretty uncomfortable at times, and certainly activities can impact that as well.
Yeah, with a bunion, is there anything we can do to prevent bunions, or it just happens?
Well, shoe wear, appropriate shoe wear. So I wear what not to wear. So you want to wear nice, wide toe box shoes that don't really put your toes at a position to be scrunched up. Most people wear a half size or a size smaller shoe than what they actually should be. So it's a good idea if you're going shoe shopping, go at the end of the day when your foot's going to be more swollen, and give a real true estimate of what your foot will be like throughout the course of the day, and make sure there's enough room and there's comfortable. But there's no way to prevent it. If it's going to happen, it's going to happen. There's some genetics that play a factor in that, certainly, because men are not void of this, and they do get bunions, and certainly there's not a lot of men walking around in high heels and really pointed shoes, but they can certainly, so there's a genetic component to it. We don't know how much, but.
Right. So gout and bunions and also arthritis is also an issue for people suffering from toe pain.
Very common. It's not uncommon for someone to come in with the understanding or thought that they have a bunion, to then find out that it's actually arthritis of the big toe joint. And that's the most commonly affected joint in the foot to develop arthritis. And basically you get a big bone spur on the top, which is where it's commonly confused with a bunion. Restricted motion and pain. Oftentimes people try and avoid putting pressure through that joint, so they'll walk on the outside border of their foot to try and accommodate and lead to other issues with their foot because of poor mechanics. But that joint can get pretty arthritic and pretty painful.
Mm-hmm. Now, I think most people that have the toe pain aren't thinking surgery right away, nor should they.
Correct.
Are there simple things we can do to help alleviate the pain in any one of those situations?
Like we spoke about, making wise shoe choices, making sure that they're the appropriate size, softer material, so the really restrictive leathers and things like that can actually increase bunion pain specifically because there's really no room, and even the arthritic pain. Wearing more stiffer-soled shoes can also be very helpful, especially in the arthritic situation, because it just prevents that joint from moving, and it can really help with that pain. That's the biggest and easiest thing to do. There's a lot of bunion straps, bunion pads. Nothing reverses a bunion. Once it's there, it's there. And how quickly will it progress and how severe will it get? No one really knows. It's just time and seeing what your body does. If you have a grandma with a bunion that overlaps and you are already developing one, pretty good chance you're going to follow in grandma's footpath. But that's the main easy treatment.
So if you've got a physical bump. You notice a bump. That's probably a bunion. You probably need to get in to see a doctor or surgeon like yourself. Are there any other signs that we should be getting into the surgeon just to discuss at some point?
If you notice it's changing the way that you're walking, so if you're accommodating for the foot pain, walking on the outside border of your foot, limping, anything that's changing the mechanics or causing you to stop doing a certain activity that you used to enjoy doing, those are the red flags where you say, okay, something more is going on and maybe I should get this evaluated.
Okay, so I come in for an evaluation, we sit down. At what point are you suggesting surgery?
When we've tried everything simple and you still have a lot of pain and limitations and you come saying, hey, I'm willing to accept the risks of surgery, let's go ahead and do this.
And in terms of the surgical options and recovery time, I suppose each one is a little different?
They are. So bunions, it depends on the severity, it depends on if there's any underlying arthritis, but you can certainly realign for a bunion surgery or fuse the toe straight. With arthritis, you can just clean off the bone spurs and clean up the joint. A newer implant that we have on the market is a little plug, essentially, that makes a little joint surface. Once you clean off the spurs, you put this little plug in there, and that allows some motion of the joint. For those who still want to wear heels, sometimes cowboy boots are an issue because you have to get through that bend. And then the gold standard for arthritis is fusion.
Right. I would imagine recovery varies from person to person, but once that recovery is complete, that rehab is complete, I would imagine a complete different quality of life.
Absolutely. It takes a while to recover from foot and ankle surgery. It's not a easy thing to recover from, but usually around that 3 to 4 month mark, you're really turning the corner, getting into regular shoes around that 8-week mark.
All right. Well, we appreciate, once again, you taking some time with us.
Perfect. Thank you.
If you're experiencing any of those toe problems that Dr. Sandoe talked about, you can always give her a call at 303-8700, or you can check with your primary care provider to get things started. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.